From the San Francisco Public Press, you're listening to Civic, where we investigate the policies and institutions that govern our lives. Towards the end of the COVID-19 pandemic, a grim depiction of San Francisco began dominating the media.
There was a guy who passed out in front of our door with a needle hanging out of his arm.
But news outlets focusing on shocking scenes give very little thought to why people are on the street and what alternatives are available to them, or more importantly, not available.
Where we're failing, what we're missing, it is housing folks. We cannot treat folks effectively if they are not housed or sheltered.
Throughout my investigation into the roots of San Francisco's overdose epidemic, I learned that drug addiction and homelessness are intrinsically linked, but not in the way that we may typically believe. I'm Sylvie Sturm, and this is Civic. San Francisco's always been known as a city of nonconformity. Maybe that's why I've been enamored with it for as long as I can remember. I was just a kid when I fell in love with its almost mythical reputation as a hub of counterculture, where free-spirited artists could express themselves and passionate activists fought to make the world a better place. I finally got to visit San Francisco in the late 1990s. Walking along Market Street to Union Square made a lasting impression. It was Sunday morning and surprisingly peaceful. The streets were empty, sunshine bounced off a sea of windows, streets glimmered from an early morning mist. I could even hear birds chirping. That memory was still imprinted in my mind when I came back 18 years later. So I was saddened to see that the neighborhood streets now included tents sheltering people without housing. Media reports were laser-focused on the city's most troubled neighborhoods, the Tenderloin and south of Market, and they painted a gruesome picture.
The main issues plaguing San Francisco: open drug markets, homelessness, and property crime.
If you haven't said it yourself, you've probably heard it said. Homelessness in San Francisco has reached a breaking point.
More than 70% list homelessness as one of the city's top problems.
Drug use on the city streets is a big issue as we approach Election Day.
There was a guy who passed out in front of our door with a needle hanging out of his arm.
That was 2015. A double crisis of homelessness and opioid addiction had taken a devastating toll on San Francisco. Since then, it's only gotten worse. Much worse. In our series, San Francisco and the Overdose Crisis, we investigate the root causes of the overdose epidemic, what's being done to help, and what might be making things worse. In this episode, I'll take a look at San Francisco's long, troubled history with housing and homelessness, how it connects to drug use, and ultimately, fatal overdoses. We hear over and over again that addiction can lead to homelessness, but we don't often hear that homelessness can lead people into addiction. We met Susan Lefevre in our previous episode. She lived on the streets in San Francisco for 10 years. Lefevre explained that the reality of living on the street causes deep trauma. And for many, the way to cope with that pain is to take more drugs.
Especially if you're a single woman, you have to worry about getting raped. You have to worry about all kinds of stuff, people coming at you, trying to put on, especially the men, and they try to put on all different faces to try to gain your trust just so they could turn around and be able to do that to you. And so for women, it's a lot harder, which severely increases the drug intake because that's all you're bombarded with. It adds to that messed up place, and some of us come from backgrounds where we're molested as children. And so to have that around you and not having the coping skills, and you see that and not knowing how to cope with that, that increases that intake.
And so-called sweeps only add to the suffering. When city employees remove or sweep away tents and belongings, they're supposed to bring possessions to a city depot. But dozens of people experiencing homelessness report that employees routinely seize and destroy everything they own, including prescriptions, mobility aids, family photos, and even loved ones' ashes. Lefevre said that creates further chaos and trauma in the lives of unhoused people.
We either move or we get arrested and all of our stuff goes in the trash. They don't stop to think that's all we have. We don't have anything else. You throw all that out, now we got to start all over, which once again adds to that messed up place.
The Coalition on Homelessness sued the city to stop these sweeps. The suit argued that, quote, as long as there is no option of sleeping indoors, the government cannot criminalize indigent, homeless people for sleeping outdoors on public property on the false premise that they had a choice in the matter, end quote. Currently, there isn't enough shelter space to meet demand. The city has 3,000 shelter beds for 8,000 unhoused people. The Department of Homelessness and Supportive Housing reopened a shelter reservation wait list in mid-July after it was closed early in the pandemic in the spring of 2020. On August 15th, the department's reservation dashboard totaled 418 people on the wait list. Last December, a federal judge temporarily barred city officials from clearing tents without providing people with immediate emergency shelter. She said the court injunction would remain as long as there are more people experiencing homelessness in San Francisco than available shelter beds. But that hasn't stopped the sweeps, according to homelessness advocates. Lawyers for the coalition provided the court with statements from more than 20 unhoused people and witnesses, stating that police continue to seize and destroy tents and belongings, including rain gear. On August 9th, homeless advocates suggested a settlement framework. They included prioritizing affordable housing, expanding access to temporary shelters, responding better to the needs of unsheltered residents, and implementing court supervision and public oversight measures. It also proposed leaving law enforcement out of encampment sweeps. While negotiations continue, city officials have defended their approach, saying they need to be able to clear encampments because they're unsafe. They also argue that a lot of unhoused people turn down shelter and housing. Gail Gilman, a chief strategy officer for the housing advocacy group All Home California, explained why people might turn down a shelter bed during a public hearing on homelessness at City Hall last March.
We also recommend transforming the two largest congregate shelters into non-congregate settings. We have all seen the weather that's taken place here in San Francisco. I'm a proud North Beach District 3 resident for over 25 years, and the back room of my apartment flooded from the rain. We have individuals who are choosing to remain on our streets in these weather conditions and not accept shelter because congregate settings are challenging. And while I commend the providers who run those systems, we have learned through the pandemic that having your own room, your own lock and key, to have the agency to be able to come and go and feel safe is what brings people indoors. So we are recommending to convert as much as possible of congregate shelter to non-congregate settings, knowing there'll be a loss of beds to the system, but we feel it will help utilize the system better.
Susan Lefevre said she didn't go to a shelter when she lived on the street because of all the negative stories she'd heard.
I heard so much bad things about it. I wasn't going to go in one. From what other people tell me, you got employees equally as shady, vindictive, the whole haters thing. And I don't know, I can't tell you how many people have told me that they walked in to go to GA and they come back in and their stuff is gone.
She also explained that some people with PTSD can be triggered by the undignified treatment they sometimes experience.
The attitude of, well, okay, I'm in charge here, and I said, but wait a minute, I live here. And so when they're talking to me, well, you do know that you're guests, and I was like, look, you just started working here, but I've been living here for 3.5 years. I know what time my guest is supposed to leave. What you're not going to do is talk to me like I'm some type of teenager living in a halfway house, because that's not what this is. It's very triggering. When you suffer trauma as a kid and not being able to be in a position because I wasn't grown enough to fight back, one of the PTSDs to that is that you're not going to really tolerate people talking to you like that.
City officials at the forefront of the fatal overdose crisis acknowledge that a lack of housing and shelter is a driving force in widespread substance abuse. Michael Mason is the section chief of administration in the San Francisco Fire Department's Community Paramedicine Division. He spoke at a California State Assembly hearing on fentanyl last May.
And when we talk about where the gaps are and where we're failing and what we're missing, it is housing folks. And that's a fundamental. We cannot ask folks or treat folks effectively if they are not housed or sheltered.
In 2016, the state of California passed a bill requiring all housing programs to follow the Housing First model. That's meant to contrast the long-established Treatment First model. Treatment First starts with your typical rehab center. It provides temporary lodging and healthcare services. Then the client goes into transitional housing while continuing their treatment. And finally, they get permanent supportive housing. But this is all conditional on staying clean. Any relapse gets them back to square one, even if that means kicking them back out onto the streets. The Housing First approach prioritizes access to a stable place to live as the first step in addressing homelessness. Housing does not hinge on abstinence, but it does include supportive, intensive case management, or what's called assertive community treatment. That's for people with the most severe forms of mental health disorders. Sarah Evans is the Division Director for Drug Policy and Global Programs for Open Society Foundations. That's a grant-making network founded and chaired by business magnate George Soros. Evans has spent decades advancing harm reduction initiatives around the world.
We need housing with supports where people can get supported and stay there even while they are continuing to struggle with substance use disorders of all kinds and mental health issues. The way that people get off the street is by getting into housing with supports. And that's a difficult thing to move forward for many reasons, including budgets, but it literally is the only way. There is actually housing available, and it just isn't always offered in a sort of housing first type model to those people who are falling through the cracks and ending up on the streets. And so closing those cracks would be, my first port of call.
But San Francisco's history has made that a huge challenge. For generations, city policies have undermined or outright destroyed low-income and supportive housing. In the last episode, I talked about single residential occupancy buildings, or SROs. They were built to house workers in the early 1900s and went on to serve as affordable options for generations to come. But a few decades later, this low-income housing had become really inconvenient for the long-term plans of the city's economic and political elite. So, SRO neighborhoods were targeted for elimination. Justin Herman, who was executive director of the redevelopment agency from 1960 to 1971, infamously said of SRO properties south of Market, quote, "This land is too valuable to permit poor people to park on it," end quote. The push for redevelopment wasn't just targeting the poor, it also targeted people of color. The lobbying group SPUR, which then stood for San Francisco Planning and Urban Renewal Association, issued a report in 1966 called Prologue for Action. It read, quote, "If San Francisco decides to compete effectively with other cities for new clean industries and new corporate power, its population will move closer to standard white Anglo-Saxon Protestant characteristics. Selection of a population's composition might be undemocratic. Influence on it, however, is legal and desirable for the health of the city," end quote. The celebrated author and social activist James Baldwin talked about the marginalizing effect these policies had on the Black population in a 1963 interview.
A boy last week, who was 16 in San Francisco, told me on television. He said, "I got no country, I've got no flag." Now, he's only 16 years old. They were tearing down his house because San Francisco is engaging in something called urban renewal, which means moving the Negroes out. It means Negro removal. That is what it means. We're talking about human beings, these Negro boys and girls, who at 16 and 17 don't believe the country means anything that it says and don't feel they have any place here. Am I exaggerating?
No, I certainly could not say that you're exaggerating.
The fact that systemic racism is a powerful root cause of drug addiction and homelessness comes into stark relief when we look at the numbers. While 5% of San Francisco's population is Black, they make up a third of fatal overdoses and more than a third of the city's homeless population. That comes from a long legacy of racist housing policies that still reverberate today. The current incarnation of SPUR, which now stands for San Francisco Bay Area Planning and Urban Research Association, has made strong statements about correcting past wrongs. The organization said it's striving to understand how past policies shaped by systemic racism and bias have led to current circumstances. And in July 2017, Justin Herman Plaza was renamed Embarcadero Plaza after the city acknowledged that Herman played a huge role in displacing poor and minority residents from the Western Addition, Fillmore, Chinatown, and South of Market neighborhoods. But that recognition doesn't undo the damage. All in all, experts estimate that more than 20,000 families were displaced by the leveling of these thriving neighborhoods. Another legacy of systemic racism in housing that still reverberates today is what's known as redlining. While white Americans across the country received government benefits in the 1940s, 50s, and 60s that would provide their families with wealth for generations to come, Black Americans were frozen out. Venice Wagner is a journalism professor at San Francisco State University. She authored an award-winning article titled Living in the Red: Black Steelworkers and the Wealth Gap.
It was the Homeowners Loan Corporation, which was an agency started by the US government during the Depression. And the idea was the agency wanted to buoy the housing market by allowing people to take out mortgages or loans to repair their homes and to give them greater value, all of that kind of stuff, right? What this agency did was they created maps around the country of various cities. And in these maps, they designated homes that would be viable for this mortgage program. And if the area was Black, then it was considered blighted. And so that action in and of itself was replicated through banking policy through the years. And the areas that were blighted were actually denoted in red, which is why we use the term redlining today. There are areas here in the Bay Area, like if you look at the old redlining maps, if you juxtapose those maps on top of a current map, you will see that the legacy of that discrimination of the access to banking policy is still impacting communities today. You can juxtapose them and see the areas of distress that remain today.
Many displaced families left without generational wealth turned to federal assistance in the form of public housing. But in the 1970s and 80s, the federal government withdrew from public housing and put it entirely in the hands of private interests. New public housing developments came to a complete halt, and funding instead went into the pockets of landlords in the form of Section 8 subsidies. Meanwhile, from 1978 to 2002, the number of households living below the poverty line rose by 25%. And by the mid-1990s, there were almost twice as many very low-income families as low-cost housing units to accommodate them. Randy Shaw is the director of the Tenderloin Housing Clinic. He's written a number of books about the housing crisis and homelessness. His most recent one is called Generation Priced Out: Who Gets to Live in the New Urban America?
The percentage of people who are helped by federal entitlements in 1980 has never been regained in the United States. So homelessness really took off as the old yuppies we'd heard about returning to the cities, driving up rents. We needed more assistance for low-income people, and instead we withdrew assistance. And to this day, we have never come close to getting back to where we were in the 70s. Right now, 25% of eligible households get federal assistance. So the 75% that don't are either living in overcrowded units or are homeless. There's housing available, but these people are drug addicts. That's even a popular thing now about attacking housing first. Well, the problem is they're drug addicts, but actually, we know factually people can't afford housing in this country, and there's no mechanism to deal with that. So people end up on the street, and often will get involved in substance abuse because if you're on the street, it's a hard life, and they do have mental problems. But the reality is, if they had universal Section 8, if everyone who needed housing could get a voucher, homelessness would go away and pretty quickly. And yes, there's always been people with mental problems or people with severe substance abuse problems, but it didn't cause widespread visible homelessness in every major city in the United States.
In 2008, the economic meltdown of the Great Recession pushed over 30 million people into unemployment. That catapulted levels of poverty across the state and the country. A year later, the Center on Budget and Policy Priorities think tank estimated that more than 6 million families were living in deep poverty. More than 500,000 people used homeless shelters across the country sometime that year, and San Francisco reported a 50% increase in the wait for emergency shelter beds. Today, 90% of Californians experiencing homelessness list income loss as the primary reason for their displacement. That's according to a recent UCSF Benioff Homelessness and Housing Initiative study of homeless adults in California, the most comprehensive statewide survey in nearly 3 decades. In 2010, on the heels of this economic collapse, a tech boom in San Francisco made the housing situation worse. This 2019 CNBC report explained the impact.
The growing number of tech workers created a housing shortage in the Bay Area, with an 8.4% increase in population and less than a 5% increase in housing units between 2010 and 2018. The increasing salaries of these tech workers created staggering housing prices, with software engineers making a starting salary of about $160,000 annually at Apple, Google, and Facebook, 40% more than the national average for the same job. Rent prices in the Bay Area increased 21% from 2010 to 2017 when adjusted for inflation. These were major contributing factors to the Bay Area's housing crisis.
Housing access, which was already very limited in San Francisco, became even more inaccessible. That displaced low-income residents who were barely hanging on. Matthew Desmond is a professor of sociology at Princeton University and an expert on poverty in America. He explained the struggle in a lecture series for the Stanford Center on Poverty and Inequality.
Poverty is talked about as something about jobs or welfare, the family or the criminal justice system, and all those things are very, very important, but there's something missing, and that's housing. The American public and its policymakers long have thought that families should spend about 30% of their income on housing costs. If you look at the past 15 years, median asking rent has increased over 70% adjusting for inflation. It's an incredibly historic rise. You've seen a rise of poor renters spending more of their income on housing costs, to the point that today, only about 18% of poor renters spend 30% or less on their housing costs.
According to city data, from 2011 to 2019, San Francisco's homeless population soared from more than 5,600 to more than 8,000. And while homelessness rose, so did drug use. As I talked about in the last episode, the number of people who injected drugs in San Francisco from 2006 to 2016 went from fewer than 10,000 to nearly 25,000. By 2008, residents demonstrated their concern when they overwhelmingly supported a proposition called treatment on demand. Despite voters' efforts, the rising rates of homelessness may have contributed to fewer people entering treatment. According to a city report, the number of admissions to treatment programs in San Francisco declined between 2015 and 2021, from more than 10,000 admissions to fewer than 6,500. The report noted that homelessness has a complex effect, acting as a barrier to some substance abuse disorder treatment, while new housing provides opportunities to develop novel approaches to treatment. By the time the COVID pandemic hit in 2020, San Francisco's rate of fatal overdoses had risen to 2 deaths a day. Between 20 and 30% of people dying of overdose each month were listed as having no fixed address. Word spread that people were dying on the street. The state responded with Project Home Key. That's a program that provides local government agencies with funds to purchase and rehabilitate housing. It enabled the city to provide thousands of people living outside with temporary housing in empty hotel rooms. The initiative, called the Shelter-in-Place Hotel Program, peaked at more than 2,200 rooms in 25 hotels and provided beds for nearly 3,700 people. That's according to data from the Department of Homelessness and Supportive Housing. Once the program ended, about 65% of the people who were living in hotel rooms found some form of housing through city agencies or on their own. But that still left more than 1,000 people returning to the streets. In 2020, the city announced a 2-year initiative called the Mayor's Homelessness Recovery Plan. The goal was to increase the city's supply of supportive housing units. The Department of Homelessness and Supportive Housing paid nonprofit groups about $356 million to provide rooms and aid to formerly unhoused people in about 80 SROs. The buildings, which are mainly leased from private landlords, can house roughly 6,000 people. Susan Lefevre said that housing provides welcome relief, but it's not easy to connect with the homeless outreach team, which facilitates the process. They're also known as the HOT team.
I don't know how many times they passed me up to let me know when a van was going to be here to pick us up. And so there's like 4 times that I missed it for whatever reason. And so then I found out through a friend of mine that I was walking around to see and said, the hot team's going to be here tomorrow. It's like, okay. So I had to, pack up everything and move my stuff there.
Once the process got rolling, things got easier.
When they came, we were able to go to the navigation centers. And so once we got in it, everything else, they kind of pretty much did everything for us. We just had to show up to sign the papers. And the navigation center I was in, they were really good about that.
Lefevre lived in a navigation center for over a year. That's a longer-term shelter with supportive services. Then she secured supportive housing in an SRO managed by a city-contracted nonprofit agency called DISH, or Delivering Innovation in Supportive Housing. That was nearly 3 years ago. And so once you got into and secured this housing, how did your life change?
It made me feel a lot more stable, like I have a steady. I'm not trying to figure out, okay, how am I going to do this? How am I going to pay for that?
Did it change your drug use at all, having housing?
Actually, it did. My intake is considerably less. There's not the emotional stress.
In an upcoming episode, we'll take a look at the grassroots efforts to reverse overdoses in San Francisco. And we'll hear about Lefevre's renewed sense of purpose after joining a program in her building that enables her to save people who are ODing. Meanwhile, San Francisco announced a plan to reduce unsheltered homelessness by 15% over the next 5 years, with an emphasis on racial equity. The city budget allocates nearly $1.4 million to the Department of Homelessness and Supportive Housing over the next 2 years. But Supervisor Raphael Mandelman criticized the budget's priorities, saying it overinvests in permanent supportive housing and underinvests in basic shelter. Since October 2020, Mandelman has been pushing his Shelter for All initiative. It's an ordinance that would direct the Department of Homelessness and Supportive Housing to find a way to provide shelter to anyone who wants it. Mandelman argued for more funding for shelter beds during a public hearing on homelessness last March.
In New York City, where residents have a right to shelter, 96.2% of people experiencing homelessness have some form of shelter or transitional housing. Here in San Francisco, only 57% of people experiencing homelessness have some form of shelter. I think we have to develop a realistic roadmap to address unsheltered homelessness that does not allow our sidewalks to serve as the waiting room for housing. And I hope, and you've received a slew of emails to this effect, that we fund the creation of at least 2,000 new shelter beds over the next 3 years. We have the funds to do this. And I think there are few projects more important to San Francisco's future than ending street encampments. But we can't do it without additional shelter.
Meanwhile, Breed said that people don't want to see increasing supportive services because, she says, more services will just create more problems.
Every constituent that I've talked to, not service provider, constituent in the Tenderloin, they are adamant about opposing more and more and more and more services. They want to see safety. They want to see police. They want to see a change in their neighborhood. They want someone to listen to them when they're asking to be in a safe neighborhood. They don't want any more services to continue to dominate their community and then provide an additional layer of problems that have continuously plagued the Tenderloin community.
I walked around the Tenderloin asking merchants, residents, and yes, service providers what they thought of Breed's comments. I didn't encounter the compassion fatigue that Breed seemed to be implying. In fact, just the opposite.
My name is Adil Saif Tahami.
Are you the owner of the shop?
Yes, this is Twin Apple Market.
How long have you been here?
I've been in the Tenderloins for 17 years. Oh, they need it, especially in the Tenderloins. They need help. They cannot take it away, They have right, like, they citizen and they have right. They need somebody with, beside them to speak for them.
So the idea that you're just tired of seeing people outside your shop or that you're sick of it or anything like that?
No, I'm not tired. I respect any people, and people like that is not just a drug, it's a mental health. And they need somebody with them to help them. If they don't have no family, they have a social worker. They have the city people that can help them from a lot of sides. I never get tired of them. And I look at them like people they need help.
Stephen Rice works for Code Tenderloin, a homelessness outreach and supportive organization.
I don't know anybody who thinks like that, but with the condition of the Tenderloin that we are looking at, I don't need anybody to tell me that the Tenderloin needs services. All I got to do is go outside, and I see that the Tenderloin needs services. Mm-hmm. The answer to the question is outside. Mm-hmm. So it is really not a debate.
Alexandra Prey is a Tenderloin resident who works for the Public Defender's Office.
I was enraged when I saw that whole exchange because I don't know who the constituents she's speaking to are. And she's not very transparent about that. But what we want, I want the mayor to send in DPW to clean up the streets because, it's the atmosphere, right? There's trash on the streets. It seems like no one cares about the community. There's always trash on the streets, and it pisses me off. So we don't make that kind of investment in the community.
Portraying people in need of services as the problem is the kind of stigmatizing language that creates barriers for those seeking help for addiction. A ton of studies have shown that stigma can worsen a person's addiction and their health because they'll develop strategies to evade shame. Strategies like avoiding or delaying health care, denying drug use, downplaying pain, and getting deeper into their addiction to cope with pain. A poem by Susan Lefevre makes that clear.
Yet people look at us with judgment in their eyes, so much about us they don't realize, like how many times we cry alone from shattered families and battered homes, the parts of us we don't make known because we're judged by people who have families and homes. They have people that care, that love them so, while we survive the streets with no place to go. Yet people judge on what they've never been through, but would they be able to survive the way that we do if they had to walk a mile in one of our shoes? The ignorance of the words and what people say, we beat ourselves up with those words with each passing day. All the mistakes that we have made, the price we paid for those along the way. Yet all people see is us doing drugs. But even at times, that's not enough because that messed up place surfaces back up. And we act out in ways that make us look tough, or yelling or screaming or talking to ourselves because there is nobody else. But that's how we show we're breaking down inside by acting out what we're trying to hide. But there's so much more to us than what people see. We have hidden talents that no one believes, no way to really show it out in the streets. There's no place that we can go where we can create and let our talents show and display the things that we can do and maybe bring out some talents that we never knew. An outlet to keep our thoughts from running away with our minds, a new way to cope of a different kind. And for the people that judge based on what they see, this life on the streets isn't where we want it to be.
Stigmatizing language also influences public perception. Hearing public figures and political campaigns repeatedly refer to homelessness and addiction as a choice has made San Francisco residents increasingly unsympathetic and infuriated. Some harm reduction advocates I've spoken to say that's an opportunity to score political points. They say that's what drove the latest move to deal with the suffering on the streets, a military-style crackdown. This is from KTVU.
The governor, with the support of the mayor of San Francisco, has called in the National Guard to try to stop the epidemic of fentanyl deaths on city streets.
Governor Gavin Newsom announced that the National Guard and the California Highway Patrol would help the San Francisco Police Department crack down on open-air drug dealing. But it wasn't just drug dealers in the crosshairs. Police and deputies from the San Francisco Sheriff's Office are now jailing people who use drugs under an initiative called the Intoxication Detention Pilot Program. Advocates and addiction health experts are deeply alarmed by the decision to start jailing people who use drugs.
There's an absolute sharp increase in deaths, and it will continue to increase until we do something about it, and that something is not going to be throwing people in jail. That's simply not going to work, and it will probably even cause an uptick.
We'll get into that in our next episode. I'm Sylvie Sturm, and you've been listening to Civic. Civic comes to you from KSFP LP 102.5 FM in San Francisco. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes producer Leanna Wilcox and contributor Mel Baker, who is also the program director at KSFP. KSFP is a project of the San Francisco Public Press. Find our reporting at sfpublicpress.org. This episode is part of a series on San Francisco's overdose crisis and prevention efforts, underwritten by a California Health Equity Fellowship grant from the Annenberg Center for Health Journalism at the University of Southern California. Subscribe to our podcast by looking for Civic from the San Francisco Public Press wherever you get your podcasts. Thanks for listening.